My name is Audrey Turchi, and my patient today is Nikki McLean. And I'm going to be assessing her chest, her lungs, and her cardiovascular system, specifically her pulses and her heart sounds. So first I'm going to start by assessing the patient's chest. I'm going to be looking for just visual signs of respiratory difficulty. So just take some normal breaths for me. All right, and upon just visual examination, I don't see any signs of respiratory difficulty. So next I'm going to move to the anterior chest, so the front of her chest. So what I'm going to do first is I'm just going to look, and then I'm going to palpate, and then I will listen. So first I'm going to look and see if her chest is symmetrical. So nice and tall for me. Perfect. And then next what I'm going to do is I'm going to feel and make sure she doesn't have any bony prominences that are sticking out, or any like sensitivity, bruising, anything hurt. Perfect. Okay, and then next I'm going to do rate and rhythm of her breathing. A normal adult should have anywhere between 14 to 20 breaths a minute. So just breathe normal. And I assessed her for 30 seconds, and so I'm going to multiply that times 2, and I got 16 breaths per minute. So next I'm going to listen for any like audible wheezing, crackles, rales, retractions, anything like that. So first I'm going to look at trachea, and I'm going to feel, so straight neck for me. I'm going to feel trachea. Trachea is midline and symmetrical. And next, we're going to see if she has any retractions. We're going to specifically be looking right here in the neck area to see if she has any retractions. Right here. Just take a few deep breaths for me. Perfect. Upon just looking, I don't see any retractions or like sunken in skin when she takes a deep breath. So that was for her front of her chest, so her anterior. Next I'm going to just look at the back of her chest, so posterior. I'm going to look, make sure she doesn't have any bony prominences that are sticking out, any sensitive areas, any like bruising as well. So what I'm going to do is I'm just going to touch. You tell me if you feel any sensitivity, anything that hurts.
Nope.
Perfect. So next I'm going to assess for chest expansion. So to check for expansion, I'm going to place the thumbs close to the spine and at the level of the 10th rib. And what I'm going to do is look for expansion and retraction of my fingers. And it should be about 2 centimeters and equal. So what I'm going to have you do is, if you want to scoot up just a little bit. Perfect. Like I said, I'm going to check in for that 10th spacing, and she's just breathing normally. Deep breath. And one more. All right. Chest expansion is equal on both sides. I don't see any like large gaps or any abnormal retractions, and it's about 2 to 3 centimeters. So next I'm going to do tactile fremitus. So how I'm going to do that is I'm going to place my hands on the back of her chest, and I'm going to place them right under her scapula area. And I'm have her say 99 until I say stop. And tactile fremitus, I'm just making sure that the vibrations in her chest are normal when she's saying the 99 phrase. So what I'm going to do, and just say 99 for me.
99.
One more time.
99.
One more time.
99.
And again.
99.
One more time.
99.
Perfect. When she said the 99 phrase, I felt equal vibration on both sides. So fremitus is normal in the posterior chest. So next, I'm going to percuss the back of her chest, so her posterior side. So with percussion, I'm looking for the vibrations in the bones on her back, just making sure everything is equal and normal. So what I'm going to do is I'm going to place my hand on your back. I'm going to feel a little tight or a little light touch. I'm just going to go down your back, okay? Not to do anything, just sit right there. Any sensitivity when I'm doing that?
Nope.
So what I was doing is I was moving in a ladder motion in her back, and I was using my left hand for feeling and my right hand to percuss. On inspection, her lungs are equal in resonance and vibration. There's no hyperresonance or areas of dullness that I would be concerned with. So next I'm going to do diaphragmatic excursion, and I'm going to check for that. So what I'm going to do is I'm going to start at on the back of her chest, and I'm going to start at the bottom of her diaphragm. I'm going to ask you to take a deep breath out, and I'm going to percuss while doing this, and I'm going to have you take a deep breath in. I'm going to percuss again, and usually there's no diaphragmatic excursion seen, and it's usually 3 to 5 centimeters if any. So what I'm going to do, I'm going to have you take a deep breath out. Perfect. And then deep breath in. Perfect. Usually if you would see any like excursions in the diaphragmatic or the diaphragm, it'd be about 3 to 5 centimeters. So next I'm going to listen to posterior breath sounds. So what I'm going to do is I'm going to take my stethoscope, I'm going to take the diaphragm part, and I'm going to move from left to right in the ladder position. And all you're going to do is just take normal breaths. What I'm listening for is vesicular breath sounds, no crackles, wheezing, bronchi. Alright, so what I'm going to do is I'm going to auscultate and listen for breath sounds in her back. So what I'm going to do is I'm going to start at the left side and work my way down in the ladder position. I'm listening bilaterally for vesicular breath sounds, making sure sounds are soft and low pitched, that there's no adventitious sounds like crackles, wheezing, or bronchi noted. So I just want you to breathe normally. Alright, go ahead. Alright, so when I was listening, I didn't hear any crackles, wheezing, or bronchi. Breath sounds were equal bilaterally on both sides. So next I'm going to listen for agonaphy, bronchophony, and pectorally. Agonaphy, so what I'm going to do is I'm moving to the front of her chest. I'm going to start at her right shoulder, at the very top of her right lung at the apex, and I'm going to work my way down. And what I want you to do is I just want you to say 99.
Okay.
All right, say 99.
99.
Again.
99.
Again.
99.
One more time.
99.
One more time.
99. 99.
Perfect. Again, I didn't hear any variation in the vibration when she was saying 99. So for bronchonophy, I'm going to listen to the back of her chest and I'm going to have the patient say E. And again, I'm listening for the vibration and the equal like vibration when she is saying E. So again, just say E over and over and I'll tell you when to stop.
Okay. E, 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 E.
Okay, you can stop. Again, the vibrations when the patient was saying E are equal. And then the last four, the pectilicory is I'm listening to her posterior side of her chest, and I'm going to have you whisper 1, 2, 3, 4.
Okay.
So just say that phrase over and over.
1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Okay, you can stop. And when she was whispering, the 1, 2, 3, 4 phrase was equal upon examination and listening when I was going down her back. So next, I'm going to move on to the anterior chest. So I'm going to have you lay back. You can go ahead and lay like that. All right. So what I'm going to do first is I'm just going to look at the size, shape of her chest and thorax, make sure there's no deformities, abnormal sizing such as like bony prominences, make sure there's no lesions or sensitivity on her chest. So what I'm going to do is I'm just going to feel all around your chest. You tell me if you have any sensitivity, if you think that one place is a little more sensitive than the others. I'm going to feel your collarbones as well. I'm going to go right here. Any sensitivity?
Nope.
Perfect. And just looking at her, and again with the patient saying she doesn't have any sensitivity, I don't feel any bony prominences, any lesions, any deformities that I would be concerned with. So for chest expansion, what I'm going to do is I'm going to place my thumbs right under her bony prominence, under the breast line, and I'm going to look for that chest expansion again, just like I did on the back, the 2 to 3 centimeters. So I'm just going to have you take a deep breath. All right, deep breath, and out. Perfect. It was 2 to 3 centimeters, equal on both sides, expansion filled and then retracted equally on both sides as well. So then I'm going to listen for tactile firmness on her front side of her chest. So what I'm going to do is I'm going to take the balls of my hands and I'm going to feel over the break area in line with her sternum, so right here. And I'm going to have her say 99 until I stop, and I'm going to be listening for that equal vibration. So again, with the palm of my hands, I'm just going to go down your sternum, and I'm going to have you say 99.
99, 99, 99, 99, 99, 99.
Perfect. When she was saying 99, both sides were equal in vibration. I didn't feel any abnormal like high-pitched or low-pitched sounds. Both were equal. Right. So then I'm going to percuss her posterior chest. So I'm going to start on the left side first, and I'm going to work my way towards the middle. And then I'm going to go in a counterclockwise motion on her left side, and then I'm going to do the right side, start midline by her clavicle and go down that side, since the left lung has the 3 lobes and the right has 2. So what I'm going to do is, again, just tapping. So I'm going to do right first, so I'm just going to tap. And you tell me if you feel any sensitivity. Anything?
Nope.
All right, and left. Anything?
Nope.
normal on the right and left sides. So next I'm going to move on to breast sounds. So with the front of her chest, I'm going to have you breathe with your mouth open.
Okay.
And then I'm going to start on the patient's right side, and I'm going to work my way in the ladder position again. And so I'm going to listen, and then what I'm going to have you do is say 99, and then I'm just going to go down in the same motion.
Okay.
All right. Again, just breathe with your mouth open, normally. And I'm listening each time with a full breath. Perfect, and I'm gonna have you say 99 just until I tell you to say stop.
99, 99, 99, 99, 99, 99, 99.
Perfect. So listening to her breast sounds on her anterior chest, bilateral sounds were vesicular, and no adventitious breast sounds were heard, no wheezing, rhonchi, crackles, anything of that nature. So that concludes for her lungs and thorax. Again, I found no deformities. Breast sounds were equal. When I was percussing, I found no abnormalities there. So next I'm going to assess her cardiovascular. So I'm going to be looking at the carotid and the brachial pulse, and then I'm going to be listening to heart sounds and assessing for jugular venous pressure. Okay, so first for her cardiovascular system, I'm going to be assessing jugular venous pressure, or JVP. It's the measurement of the highest oscillation point in the jugular venous pulsation, so up here, and it reflects the pressure in the right atrium of the heart. So what I'm going to have you do is I'm going to have you lay back, and then I'm actually going to sit up for just a second. There you go, now lay back. I'm going to have it at a 30-degree angle, and I'll put your feet up for you so it's not just dangling. So first what I'm going to do is look at her neck. I'm going to look at her left side, and then I'm going to be doing my assessment on the right side. So I'm just looking for equal structures on both the right and left side, no bruising, no bony prominences, nothing abnormal. Do you have any concerns with neck or anything like that? So what I'm going to do is look at left side, and turn right, and then right side. So I'm looking for the oscillation point, and it is the little crevice right here in between this line in the neck. So, and upon just looking, I can see the carotid pulsating. Pulsating looks equal on both sides. Okay, so to assess for the jugular venous pressure, what I'm going to do is I'm going to put my sticky note and then my ruler on the edge of the point of oscillation. So I'm going to have the card where it crosses the jugular venous pressure point, so it's the point of oscillation, and it should be about 2 centimeters. So, yep. I'm looking for. And on this patient, it is about 2 centimeters. And this assessment is just important for assessing the jugular venous pressure, and then it's especially important for diagnosing euvolema, hypo, and hypervolemic patients. So next I'm going to assess the carotid pulses. I'm just going to look, and then I'm going to feel, and then I will listen. Carotid pulses also are affected by position or pressure, and they provide valuable information on vascular disease and or aortic stenosis. So first I'm just going to look, and then I'm going to feel, and then I will listen. So what I'm going to do is take my index and middle finger, and I'm just going to palpate the left and then the right, obviously not at the same time, and then I will listen. So I'm going to do, and I feel left, and I feel right, and then what I'm going to do is I'm going to ask the patient to hold her breath just for a few seconds when I'm listening to both of the carotid pulses, just so I don't get any like noise of her breathing to confuse the carotid pulse. So I'm going to do right first. Right. And when I was listening, I didn't hear any bruits present. So next I'm going to move on to her brachial arteries. What I'm going to do is I'm just going to look, and then I'm going to feel, and then I will listen. What I'm going to do is I'm going to assess with two fingers, my index and then my middle finger. I'm going to go to the inner crest of her antecubital, and I will just feel for both pulses. And then upon inspection, I could feel both pulses, and then I didn't feel any abnormal pulsating sensations in the brachial pulse. So next I'm going to inspect and locate the point of maximum impulse, or the PMI. So what I'm going to have you do is actually turn towards me on your left side, and then I'm going to have you put your arm up just a little bit. So this arm. Perfect. Actually, if you want to just, there we go, perfect. Okay, so first I'm going to just look, make sure, and then feel, make sure she doesn't have any bruising, any bony prominences, and then I'm going to palpate on her left side. So when I'm doing this, just let me know if you have any tenderness. To locate the point of maximum impulse, I'm going right at her mid-clavicular, and then over to her like 10th intercostal space, right in line with her breast line, the mid-clavicular. So again, feeling, and that is the point of maximum impulse. And so you can actually turn back over and just lay flat again. So next I'm going to be palpating for thrills. So what I'm going to do is take the ball of my hand and just go over the heart sound places where you would usually listen, and just feel with the ball if I feel any thrills. So. Okay. Patient has no thrills, so the next I will be listening to the heart sounds. I will be assessing for heart sounds 1 and 2. I will be going from the aortic to the pulmonic, and then to the sternal border, and then to the apex, and I will be listening in 5 places. So first I'm going to go in the aortic on her right side, and then I will move left to the pulmonic, and the S2 is actually louder in the pulmonic side, so I'm going to actually have you take deep breaths in and out when I'm listening on the left side, okay? listening, I heard S1 and 2. It was equal in the S1 and 2, like rise and fall. So, and then, to listen to the apex and listen for more murmurs on this patient, I'm going to have you lay again in that left lateral decubitus. So that's again the arm. And then what I'm going to be doing is just listening to the apex on the left side. And I'm listening for the murmurs. So it's the 5th position. Alright, and you can cover. And then listening, I didn't hear any murmurs audibly on this patient. And that is my full lungs, chest, and cardiovascular exam. Thank you, Nick.